What we've seen from this symposium is that, as we see in every other part of health, the social determinants define so much of what happens to a person. But in addition to that, in supportive care, we have some particular challenges. There are cultural challenges around the acceptability of treatment of symptoms in some places around the world. There's access to medications which are incredibly inexpensive and yet not widely available. And the most obvious of those are the opioids for pain. Most of the world's population have no predictable access to opioids for pain control, let alone the other major symptoms that we're discussing at this conference: fatigue, nausea, peripheral neuropathies, mucositis. So we have the challenge of both diagnosing and treating the cancer, as well as providing good supportive care around that for the person. If we're serious about improving supportive care for people around the world, we need to make sure that hand in hand with the development of cancer services, we are actively developing supportive care services. It's not something to wait for until we have perfect cancer services and then say we'll add it in. They need to grow in tandem. In addition to that, we need to make currently available medications from the WHO essential medications list available throughout the world, and that has particular emphasis on opioids for pain. It is a travesty that in 2016 the majority of the world do not have access to opioids. All clinicians have a responsibility to work with their government, with their regulatory agencies to ensure the best possible access to medications, including opioids for pain. We have an enormous way to go before we can say categorically that people around the world have timely and affordable access to medications that should be available wherever you go around the globe. We need cancer care and cancer treatment to grow in tandem. They need to grow together, and we can't grow one without the other. If we've got people whose symptoms are poorly controlled, they are less likely to finish treatment. If we've got people whose symptoms are poorly controlled, they're less likely to be able to move on with their lives as a result of successful cancer treatment. The disparities in supportive care can be addressed in a number of very straightforward ways. The challenge is doing it on the magnitude on which it needs to occur. We need to make opioids available. We need to make antiemetics from the WHO essential medications list available around the world. We need to ensure that there is good psychological support for people. So it's not just about pharmacology, it's about valuing the psychosocial support that we can offer people as they face the trauma of cancer, as they face the challenges of moving on from successful treatment, living with cancer, or indeed palliation leading ultimately to death.